So one of the newer and exciting things that have come out in this past year has been new treatments for patients who have hepatitis C. Hepatitis C has long been a concern for most of us in the GI and hepatology community. About 4 million people in the United States are unfortunately infected with this infection. Most people don't even know that they have it. It's asymptomatic. It's found oftentimes on screening labs, and we didn't really have a great test to determine it until the late 1980s or so. And the virus is transmitted by blood, even something as simple as sharing a razor in close contact. Certainly students in dorms can pick that up. Historically, it is a disease that if left unchecked, about 20% of people will ultimately go on and develop cirrhosis of the liver. And even worse than that, people who could develop cirrhosis can end up with cancer in their liver. Our treatment for it has been a challenge for some period of time. What has been exciting over the summer is there's now 2 new drugs that are available, and they encompass what's designed as directed therapy, meaning that we can treat patients and have some hard data to determine how they're responding to it, how well they're going to respond to it in the future, and determine when to stop that. Historically, 10 years ago at least, we had about a 20% cure rate. These days what's exciting is now we're approaching almost a 70% cure rate. So we're able to identify the patients who are, number one, responding well to therapy, patients who we think are going to continue to respond, and then when we look at them after treatment is stopped 6 months later, a large proportion of them have a sustained response to their virus there. So this has been a very exciting time, and I would encourage anyone who has certainly been told that they have hepatitis C, and in years past we had told them, well, wait, there's going to be some new treatments coming out. Well, they're here, and I think this is something that we encourage everyone to speak with their doctor, and certainly come speak with a gastroenterologist to see if they would be a candidate for this therapy in the future.